Officially, good afternoon. Robert Kennedy once said that it is better to light one candle than to curse the darkness. And there's another phrase that talks about the unlimited power of a candle, that it can create light without ever diminishing its own energy. There are so many candles here in this room today, and we're grateful for the kind of light that they shed. In particular, Kathy Greenlee, who has used an opportunity in history to really advance the course of elder abuse intervention. Larry Minix, the director and head of Leading Age, and his very able colleague Marcia Greenfield, who's an able advocate. Don Schulman from the Association of Jewish Aging Services. Terry Fulmer, who has been an advocate of elder abuse for so many years. Mark Lax, that so many people have mentioned, who has used scientific rigor for the first time to document the prevalence of elder abuse in the community. Michael Marcus, a program officer at the Weinberg Weinberg Foundation, who has been a real staunch advocate of the model that we're going to talk about this morning. And Joy Solomon, who's the director and managing attorney of the Weinberg Center, who brought a career as an elder abuse prosecutor to create and help create and lead the shelter model. My focus today is going to be presenting a model for intervention which is cost-effective, easily replicable, adaptable to every community, requires no government funding, and does not involve bricks and mortar. The concept that if you remain invisible, you will disappear is one that we've heard a lot about these last 2 days. Older adults come through so many systems in their lives: emergency rooms, churches and synagogues, physicians' offices, banks, senior centers, and nobody knows that they're being abused. They're invisible. When you take a look at groups of different people, 15-year-olds, 40-year-olds, 85-year-olds, you recognize that the older we get, the more different we become. If you ask a 15-year-old to count to 50, to look at a clock and tell you the time, to run a 100-yard dash, 95% of the 15-year-olds will be consistent. The same with a 40-year-old. But when you get to an 85-year-old, there will be a huge diversity in their capability to do those three simple things. And therefore, a shelter has to be responsive to the different needs that an elder victim is going to have. The community that is required to create an elder abuse shelter is a collaborative one, and it uses the existing resources of a community, any community, and each of them can be very adaptable. In particular, using a nonprofit long-term care facility, a nursing home, is one of the greatest models, and one of the reasons is that internally within a long-term care facility, there is an existing community that can be used to shelter and protect and empower victims of elder abuse. The shelter is a virtual model. The history of our shelter is really quite simple. In 2004, my colleague and I, Joy Solomon, got into a conversation about what happens to victims of elder abuse in our system. We asked our research division to look into it, and we discovered in 2004 that there were no specific shelters for victims of elder abuse in the United States. There were programs and there were support groups, but there was no place to take a victim in an emergency. We focused our efforts on designing something that would be a missing piece, not to duplicate or replicate what already existed, but to create the place you could bring somebody in an emergency situation. And it's interesting, yesterday Dr. Salerno mentioned that she thought she was doing something illegal by placing people in an emergency room when she had no place else to put them. First of all, I can reassure her it's not illegal. They have statutes called Good Samaritan statutes which protect you from liability for those kinds of things. And Dr. Dong mentioned yesterday the prevalence of emergency department usage as being 3 times the norm when victims of elder abuse were involved. And yet here's a model that would have diverted any of these folks into an appropriate, caring, and empowering community without the need to go to an emergency room or to create, I wouldn't call it an illegal, but let's just call it maybe an inappropriate placement. The advantage of using a nonprofit long-term care facility as a shelter model is multiple. First of all, we're open 7 days a week, 24 hours a day. Secondly, we have existing expertise. Every single person in every nursing home is mandated to be trained in elder abuse recognition. We have capacity. No matter how full a long-term care facility is, if they're committed to this project, we'll always find a bed. And third, it's very easy to adapt the basic model of a long-term care facility to the needs of a community. Now, my focus here is on victims of abuse who live in the community, not those who are residing in nursing homes or assisted living facilities. I would argue, first of all, that the abuse in nursing homes is overstated. It is not uncommon. I'm not here to say it doesn't exist, but we have so many laws and regulations that govern elder abuse, identification, and reporting in nursing homes. And most importantly, we have staff, most of whom, 99.9% of whom, are good, caring, compassionate people, and they don't put up with elder abuse. Every report that I've read about an elder abuse in a facility has been made by a staff member. There is a huge, and I reject categorically, by the way, the notion in the last couple of days that placement in a nursing home is a form of abuse. It's been mentioned a couple of times. I categorically reject it. I think it's unfair, and it's unfounded. A nursing home is frequently a good place for older adults to be. I also want to make a distinction between nonprofit and for-profit. This is the only area of care in our country where we have a predominant number of beds that are being run by for-profit operators, frequently with overlays of corporate structures that prevent anybody from ever getting accountability. Only 30% of the beds in this country are run by nonprofit, mission-based organizations. That's an outrage. And if you're coupling care of frail people with a profit motive, there is an inherent conflict of interest. So my emphasis here, this model, is really premised on a use of a nonprofit facility. In the United States, there are 5,000 nonprofit facilities. They represent 750,000 beds. If you take a look at the Hebrew home, we are a campus community, and you have here images of our facility. And what we do is we integrate our victims into the facility. Nobody knows who they are except the staff that are taking care of them. You see them involved in all the activities that exist in our facility. They're including art therapy, pet therapy, and you see just images of our campus located on the Hudson River in the Bronx. The basic concept is this: a bed. That's the shelter. It sounds so simple. I remember once discussing with one of my colleagues who was interested in replicating the model and ultimately did replicate the model. And she said, you know, we have to get some feasibility studies, we have to do some market analysis. I said, stop right there. All you got to do is start. You have the bed. You can decide to accessorize or customize the shelter. Obviously, it's going to be dependent on funding. One of the things you have to do is train your staff. Our staff have to understand that victims are coming in with a different set of issues than a normal admission. In our facility, we encourage family visitation. We encourage family involvement. Not so with our victims. There's an immediate 2-week prohibition on any visitation until we can identify who the abuser is and what's going on and who we should let in and who we can't let in. In our facility, we've done cross-reference training with all of our collaborative partners, the most important being Adult Protective Services. And it's just a real plug for Adult Protective Services. They are the frontline people in this war. And they've gotten a raw deal in terms of criticisms from the community, but they do this every day, day in and day out. And that's where we have to start the conversation, because they're seeing things and bringing issues to our attention. So using APS and creating partnerships, in our case, creating partnerships with law enforcement, with academics, with hospitals, with law enforcement, are critical to the success of the shelter model. We've used our facility to develop authoring articles. We've reached out to the community. We've developed collaborations with the police and other coalitions. One of the most interesting, and it was mentioned yesterday, I think, by Dr. Kalachi in Brazil, the doormen. In New York City, that is one group of people that know exactly what's going on behind closed doors. Boy, if they ever wrote biographies or tell-alls, you'd learn a lot. But we've started training the doormen in New York City, and they're learning how to recognize elder abuse. We've developed in our facility and in our model a very heavy emphasis on civil legal support. The director of the program is an attorney. There's another part-time attorney. And what we found is that the civil legal system has infinitely more effect than the criminal justice system because we know how difficult it is to prove elder abuse in older adults. And often those cases go to misdemeanor or plea bargained out. What we can do is we can use the civil legal system to get orders of protection. We can get orders to vacate an apartment. We can get all kinds. We've gotten divorce decrees in a case of a man whose wife was abusing him. And we can use the civil legal system. And I like to say this, and I don't do it lightly, but we don't have to worry so much about the Constitution because we're not a government agency. And so we can take more aggressive stands on issues of elder abuse than law enforcement might be able to. We've developed public awareness campaigns, palm cards, training of professionals and non-professionals, and replication, which I'm going to talk about in a moment. Outreach to non-traditional professionals as well, and also the intersection of domestic violence, which I'm also going to touch on. The grandparent connection, the fact that there are so many young people living with grandparents because the parents are not in the picture creates a situation where there is abuse, but we have an opportunity to do some great intergeneration training, and I love the YouTube that we saw earlier. That's a great start. And then we've taken ours to national resources, legislative initiatives, testifying before the Senate. Finally, leadership in our case in the New York City Elder Abuse Care Coordination and Review Team. We've been very active in multidisciplinary teams, which, taking a page out of child abuse, has been one of the most effective models for creating cross-disciplinary intervention in cases of elder abuse. The organizational benefits to our facility are profound. The first one is that it supports the mission. We are a nonprofit organization, and taking care of elder abuse victims supports the mission of protecting those who are in need. From a public relations standpoint, it's unbelievable. You ask people what they think of nursing homes. I understand that it's right below the IRS in terms of favoritism, in terms of a public image. When we've gone out as an elder abuse shelter, the embrace and recognition has been truly rewarding. The community outreach has been fantastic. We find ourselves in many different venues talking about elder abuse and bringing public awareness to the table. And from a philanthropic standpoint, people who may never donate money to a nursing home donate money to elder abuse and to recognizing the impact and effect that we can have. What are some of the steps we're taking from using the shelter as an initial base? The first is working closely with financial institutions. I'm very anxious to hear my colleague in a moment, but working closely with financial institutions on financial abuse, follow the money that almost always leads you to elder abuse. That we talked about the doorman education. The law enforcement training has been a very profound and effective mechanism for us. Training the police officers in the NYPD at shift change so they can recognize elder abuse when they go into it's anybody that we know gets behind closed doors we want to talk to, because the biggest challenge for us is the isolation of the victims. It's getting them, finding them, and letting them know there's a safe place to go. So anybody that we can get to, and that's the fundamental difference, as all of you know, between domestic violence and child abuse, is that the MO, the modus operandi of a perpetrator in elder abuse, is to isolate the victim and keep them behind closed doors so they can keep stealing the money and not let them out and have any recognition. So the doormen, the law enforcement, we've talked about training hairdressers, dog walkers, letter carriers, anybody that gets to see what's going on behind closed doors. Obviously, our hospital and healthcare employees, emergency room, physicians and nurses, great group of people to be aware. On Capitol Hill, we've done some testifying and presentations as well. The current initiatives that we're undertaking right now that have come out of our elder abuse model our sexual expression and training people on freedom of sexual assault and sexual abuse. There's a very thin line when you have a spouse with dementia and a spouse who doesn't have dementia, or even we've heard about late life domestic abuse. So we were doing quite a bit of work in that area, and I know M.T. Connolly is going to be speaking later. She has been a real great partner with us in developing a colloquium last year, 2 years ago, on sexual abuse. This is the Order of Protection Project. We developed a mechanism whereby older adults can testify in support of an order of protection through video, so they do not have to sit in a courtroom for 5 or 6 hours to get an order of protection. We've trained the New York State family court judges who recognize now that what they think is a quick disposition of a case is actually an endless process for an older adult who can't sit on a hard wooden bench in a courtroom. And then finally, we've added family justice centers to the list of people to make sure that elder abuse is part of that mechanism. Out of this has also come a realization that we must intervene in domestic violence within our own facility. 95% of the employees at the Hebrew Home, and we have over 2,000 employees, are women. And if you look at the statistics, a significant number of them are victims of domestic violence. We do not want people who have been abused in a domestic partnership to come in and take care of our residents. And so we're implementing a across-the-board domestic violence training and intervention and employee assistance program. In addition, we have found that screening is a very effective tool. It was interesting to hear the prior session on screening. We've implemented mandatory across-the-board elder abuse screening, particularly in our short-term rehabilitation post-acute operation, because so many elder abuse victims come out of the hospital into post-acute and nobody knew that they were abused. And out of that process alone, we have identified over 15 victims of elder abuse. The last diagram, which looks like a treehouse but really is supposed to represent SPRING, which is an acronym for a new alliance of our replication partners called Shelter Partners Regional, National, and Global. These are all examples of the shelter model being a laboratory and being a nimble place to try out new initiatives, and if they work, great, expand them. If they don't work, shut them down and keep going. But they don't require a lot of time and effort or energy to get going. The shelter replication, this has been one of the most exciting things. Our philosophy is that every community can have a shelter right now. There's nothing needed. Just find the nonprofit home and talk to them and get them going. And every time we've talked to one, we've moved it forward. In New York State, in Rochester, Lifespan has developed a consortium along our model idea that's very effective, that's just gotten up and running. In Cincinnati, Ohio, Cedar Village has developed a shelter model with our assistance. Just recently, Delaware County has developed a consortium model which incorporates nursing homes and government workers as well into a shelter model. And in Rhode Island, the St. Elizabeth's Home has developed the shelter model very much similar to the one we've developed. In Albany, New York, the Eddy Northeast Health Systems has developed the same shelter model, very effective one. In Minnesota, Crestview has developed the shelter model. And last but certainly not least, because they were the very first replication, was the Jewish Home for the Elderly in Fairfield, Connecticut. I know my colleague Andrew Banoff is here, and it was the most reassuring and validating decision that he got up and said, we're going to replicate the model, because it told us that we weren't crazy. And Andrew went ahead and developed the model, the second one in the country, and in the 5 years that he's been up and running, he's had 5,000 contacts with victims, resulting in 1,500 shelter days. And also he's taking his model and adapting it to his community. I just want to point out our shelter has been open since 2005, and in that period of time we've had 35,000 shelter days that we've provided, many where there was no source of income, but we were able to absorb them into our facility. They tend to be very low acute patients. So those are the replications, and we're currently in discussion with 3 other facilities. I won't rest until we have at least one in every state and hopefully one in every community. And I hope that all of you will be ambassadors, and when you go back to your communities, that you'll advise them that the Hebrew Home and the Weinberg Center are available at no cost to assist them in developing a shelter model in their community. Just don't send us to Minnesota in February. Tailoring the shelter model, as I talked about, it's nimble, it's flexible, it's there, it's right now. I want to just make the point. I'm not here to say it's the best model or it's the only model. Right now, it's the best we've got, and it's the only one we've got. I look forward to there being other kinds of models that might emerge and develop, but this one is practical, and it works. We've shown it over and over again, and there really is no reason why a community shouldn't do it. What I want to make the point here is that every community is different, and the beauty of the model is that it's so adaptable to the particular needs of one's community. So if there's mandatory reporting, that'll drive it in one direction. If there is an existing infrastructure for elder abuse, then it can be added on to that in a very easy way. Our model is heavy on the legal side. That's for the obvious reason that I'm a recovering lawyer, and that makes it kind of easier for me to focus on some of the civil legal issues. But more importantly is that we believe that the law is the way that we're going to get some changes done in the field of elder abuse. I am frequently looking for trouble in the legal world where we can make law. And fortunately, my colleagues are much more reasonable and kind of pull me down when I get angry so that I don't go to jail for contempt. But I do push aggressively on finding ways to make law in the field of elder abuse. It's the only way we're going to really get some changes, whether it's policy or through court cases or through the criminal justice system. Contact information for anybody that wants to pursue this is our director and managing attorney. Here is her website, her email address and telephone number. And these are two of our victims on our front lawn enjoying the beautiful autumn view of the Hudson River. Thank you.